Good afternoon, everyone. My name is Garrett Schmidt. I am the managing editor for ACOexhibithall.com. And I'm so glad you all joined us today for today's live panel discussion that's hosted by Proficient Health and Salient Healthcare with a special guest from Cone Health Ventures. And it is titled 3 Steps for Network Success. So we're very excited to have this presentation. Thank you all for coming. A few items of note before we get started. And then we'll dive into it, is everyone who has joined today is in listen-only mode. So you don't need to worry about muting your mics. That's been done for you. And your camera's not on either, so don't worry about that either. We can't see it. So, and I'd like to also let you know that the webinar is being recorded. So you will have the opportunity afterwards to rewatch the session and share it with your colleagues. And we hope that you do. This is something that we want to definitely spread the word on and feel like you can reference back. So I will, at the end of the recording later on this evening, I'll be sending everybody who registered an email that will have a link to the recording and also where you can download the slides as well. And that will have contact information for our speakers today. Finally, during the webinar, we want to hear from you. So please submit your questions through the attendee control panel. There's a little questions module, and you don't have to worry about waiting until the Q&A session at the end. Just submit them at any time, and we'll be able to pick those up. And we'll get to as many of them as we can today. Erica is going to handle that for us, and I'll introduce her in a second. And at this time, I will hand it over to Erica Grau with Proficient Healthcare to get us started. She's going to introduce our speakers and get us going. So welcome, Erica.
Awesome. Thank you so much, Garrett, and thank you everyone for joining us today. Our webinar, 3 Steps for Network Success. Can you guys see my screen okay? Perfect. 3 steps for network success: prioritize patient satisfaction, optimize referral management, and drive network growth, is hosted by Salient Healthcare, Proficient Health, and Cone Health Ventures. I'm your host, Erica Grau, Director of Marketing here at Proficient Health. Now, let's meet our presenters. Maria Nikol is a senior business consultant with over 12 years of experience in healthcare operations and healthcare strategy. Her specializations include process improvement and the application of emerging models of healthcare delivery, such as accountable care organizations, clinically integrated networks, and DCEs. Hi, Maria. Thanks for joining us.
Hi, everybody.
Awesome. We're also joined by Ryan Mackman, has been a business consultant with Salient for over 3 years. In this role, he acts as a solution trainer, marketing and sales consultant, as well as a value-based payment strategist. His skill set helps augment Salient's efforts at the provider organization and physician practice level. Prior to joining Salient, Ryan spent 4 years as the business administrator and project manager for a level 3 patient-centered medical home near West Palm Beach. Hi, Ryan. Thanks for joining us.
Thank you for having me.
Also, today we have Wayne King. Wayne has over 25 years of experience in the software development industry, having held positions in sales, marketing, product management, quality assurance, and technical support. Wayne currently serves as the VP of Client Alignment for Proficient Health. Thanks, Wayne, for joining us.
Thank you, Eric. Thank you.
And last but certainly not least, we have David Heenan. David has founded ACEs Health in 2015 and successfully exited the company in 2018 to manage Bright Edge. David currently serves as principal at Cone Health Ventures. Welcome, David.
Thanks, Erica. Glad to be here.
All right, so let's get started. There is a significant variation in quality and cost among facilities and providers in a geographic area. Value-based purchasing organizations may consider creating collaborative networks, which include selecting partner organizations and establishing a management framework to improve the quality of care and reduce overall costs. We will discuss the key steps to take in order to successfully develop and implement a preferred provider network. Now I'm going to turn it over to Maria from the Salient team, who's going to kick us off.
All right, thank you, Erica. So the first steps towards creating a preferred provider network is creating an assessment of your current network utilization. Your organization will want to create a scorecard for each type of entity that you want to create a preferred provider network with. So examples might include skilled nursing facilities, home health agencies, perhaps some various specialists, hospitalists, hospice, urgent care centers, or even inpatient rehab facilities. Each organization type will require their own scorecard and their own initiative. So you'll want to prioritize your initiatives based on where that potential savings is for your organization. So all scorecards must be based on two factors, and that's cost and quality, to derive a network of high-value organizations. First, you'll want to identify where your patients are currently going. And this may indicate, based on geography, where the need lies. Assess each organization to determine whether they provide high-quality, low-cost care. Each organization may have areas of opportunity for improvement. So, for example, a skilled nursing facility might have great quality scores on the nursing home compare sites for quality metrics, but their length of stay might actually be higher than average, leading to higher costs. Now, alternatively, there might also be outliers in your home health agencies. So, for example, a home health agency might have high quality scores on home health compare, but a high length of stay. You're going to need to do additional analyses to determine whether that specific home health agency actually works with patients that have behavioral health issues, for example, and the length of stay is actually justified. A performance management system should be able to provide you with a good overview of where your patients are going and the metrics associated with each type of these organizations. Decide which metrics are important to your organization to monitor. Now, we've provided a sample scorecard here from Salient for your reference. I would strongly encourage each organization to also evaluate their quality metrics from publicly available sources to determine whether you're creating a high value network. CMS has a wide variety of these metrics available on their compare sites. While your organization might have identified high value partners, you want to ensure that your patients are actually using those high value partners. The preferred provider patient card is intended to guide your patients to select providers in your preferred provider network. You may have partnered with high value specialists, home health agencies, or skilled nursing facilities to improve the patient experience and improve care coordination. And while patients always have the choice on which providers they utilize, you'd like your patients to utilize the preferred providers in your network due to the high value status and the improved care coordination efforts. So I'm now going to go ahead and hand it off to Wayne to dig into why referral management is so important and how to do it. Wayne?
Thanks, Maria. Yeah, so technology has actually created a situation, especially in the hospital-led ACOs and CINs, where we've got communities of providers on multiple EMRs. Generally, this is a large EMR in the hospital, and then primary care and specialty in those non-owned practices are on just a bunch of different EMRs. So this really creates a struggle for standardized communication. And we've even heard, it's the fax and forget workflow, right? Which is happening a lot today. So, but what this does is give us an opportunity really to standardize referral management so we can have one, hub, if you will, platform to allow this information to flow back seamlessly. So at Proficient, we've developed a referral management platform that's a much better workflow for the referral coordinators and the providers to do the referral process. And so it allows these referral coordinators and providers to get information out of their EMR very easily. There's a lot of lightweight interfaces. have that really good workflow where we are not faxing, we're not making phone calls, we're not tracking things in spreadsheets. And then finally, having bidirectional communication, we can keep the workflow moving. So we're really driving, patient satisfaction to get the appointments made quicker. And then finally, at the end, closing the loop and getting the consult notes and information back into the referring provider's EMR so that we've really closed the loop and we've got better information at the point of care. So you can see some of the benefits that are here, and Maria mentioned, right? Better network utilization, being able to see the providers that are using the system across the ACO or CIN, better care coordination, where we've got that information back at the point of care. We can also maybe save some cost there around duplicative testing and things of that nature. Having a standardized process for what we need in the referral process, including that standardized supporting documentation, and then also network-wide reporting. And so we provide reporting at the network level and at the practice level. And we've already mentioned patient appointment adherence. So here's an example of the Proficient Exchange dashboard. And so we picked the dashboard concept because it's familiar. And one thing in the workflow, we wanted to make it really easy for referral coordinators to do their job, right? Of all those things I mentioned, no more faxing and phone tag, voicemails, all of that stuff and tracking, we wanted to put that in a real simple to use workflow tool that's much better than the EMR, that can save them time so they can not only process more referrals, but have more attention, on patient care. And so we've got, we've got this board that you can filter down. We've got providers that have hundreds, 500 to 800 of these referrals on a board at any one given time. So we can filter that down by assigning referrals to certain referral coordinators. We can filter down by priority, and we can also sort by their age. Any blockage in the workflow can be easily identified and corrected because with the bidirectional communication that we built into the system. So we can chat about a referral, we can make comments on a referral, and we can upload any supporting documentation that may be left off on the initial referral to satisfy that referral and keep that moving through the workflow. It also provides automated updates back to the providers, so we're not having to provide that follow-up. And we'll dig a little bit deeper into analytics in a little bit. I'll pass it over to David and give us a real-world example.
Thanks so much, Wayne. Yeah, so over 2 years ago, our ACO here at Cone, Triad Health Network, which is relatively huge actually, had an issue with having transparency and understanding of referral traffic and some of the choke points that were leading to poor patient satisfaction and unclosed care gaps. So we sat down with Proficient, and over hours and hours of customer discovery and user interviews, we helped them design what is Proficient Health Exchange. And this allows, as Wayne said, for not only our primary care physicians to refer and have full visibility into that referral, what comes out of it, the time between it, but I think most importantly, our administration level has the ability to see referral traffic in real time from a 360-degree view to really understand where it's going, how the network's being utilized, and who are the poor or good performers. And in fact, this has resulted in much higher patient satisfaction, much higher physician satisfaction, as well as coordinator satisfaction. And finally, has allowed for our administration to really know who the high-performing practices are and who might need extra help getting there. Now over to Ryan to understand better how they analyze some of that network leakage.
Thank you, David. So as he mentioned, the next part that we're touching on is the assessment of your network leakage, which is, it's something that we've been building up to now. So Maria talked about the preferred provider patient card. You heard Wayne touch on referral management. At the end of the day, what you're doing with all of this is ensuring that you're keeping your population contained, which is where network leakage becomes the next important topic. Now, Once you've assessed your network to ensure that your patients are going to go to high value organizations, then you're going to want to assess your network leakage. You can't optimize your performance if your organization suffers from significant leakage, because then your physicians are essentially losing their line of sight with regards to spend and outcomes. Now, managing network utilization is great for everyone. It's great for your patients, it is great for your practices, and it's great for your provider organizations. It's a win-win, or I guess in this case, we can say a win-win-win. I'm gonna cover how here on this slide. So what we're gonna do, we'll start with the patient side, and you're gonna find that the patients that are seen continuously within your network have significantly higher patient satisfaction. Also, it's safer overall because the patient records are then passed back and forth between your primary care provider and the referring provider. If they're in the same network, then likely a specialist and a PCP are probably going to be on the same EMR. If they're not on the same EMR, then there's usually at least an agreement between providers so that they're ensure that the records are transmitted quickly. This improved communication, it also improves the patient experience, because then you have that warm handoff between providers. Hypothetically, I mean, how happy would you be as a patient if you knew that your specialist welcomed you on behalf of your PCP? Feels kind of like a concierge service, kind of like a hotel. So you would book your stay, and then you walk in, somebody says, "Welcome to our hotel. Here's a bottle of water, your room is ready." And you're thinking, "Oh, cool, I'm important." You know, that same reaction happens when your primary care provider and your specialist work together in tandem. Not surprisingly, though, this also builds more loyalty to the providers, just like it does when you're in the hospitality industry. Okay, second, I'm going to talk here about the benefits to the providers themselves. In this instance, what's most important to the providers is that they're not losing their patients elsewhere. This certainly improves the provider's financial security, because then they're consistently seeing patients. In this case, you're keeping the appointment schedule full with familiar faces. Also, by having recurring visits with the same provider or providers, now that patient's developing a relationship endearing them to their specific medical practices. And this is not only going to improve the care continuity as the patients then return to their PCP after visiting a specialist, but then it also decreases provider burnout as physicians are then able to see a care plan from the beginning until the end. Now, last is the provider organization itself. So from that perspective, reducing out-of-network referrals from 20% to just 10% can certainly mean healthier patients, but it also leads to more in-network revenue. Currently, this is particularly important because facilities that are looking to kickstart that post-pandemic recovery process, that's one way to address that. And then by reducing out-of-network referrals, you're also reducing overall costs for the long term while improving quality of care, which is then going to show up in your quality reporting. So you're effectively killing two, or I guess in this case, even 3 birds with 1 stone. So we've set the table now by providing the benefits of network management, and now comes the part where I can show you that network management goes a lot smoother as long as you've got the right solution to give you the information that you need. So what I'm showing you on this slide, this is the Salient Healthcare Dashboard's brand new look, complete with a network management dashboard built in. So you can see on that left wheel there, or we call it a donut, that's your in-network versus out-of-network utilization. Then on the right-hand side, you have your network leakage. It's broken down by facility type, which you can then discover where your patients are going using the facility scorecard. And from here, you then have the ability to strategize and build those initiatives towards addressing any network leakage that your particular provider organization is experiencing. Okay, now I'm going to hand this back over to Wayne. He's going to talk about how the in and out of network utilization can be managed. Wayne?
Thanks, Ryan. So great explanation, by the way. So, much like Ryan showed you the Salient dashboard, now we're looking at the Proficient Exchange dashboard, and we're specifically looking around out-of-network volume, right? So having that standardized referral management system in place which gives us that comprehensive view now. Remember, across all providers in the network, we've got all the referrals coming through the platform now is really going to drive our network reporting and our analytics. So the first thing too, simply having a provider directory that's centralized in a referral management platform, that alone drives more in-network referrals. Prior to that, referral coordinators had really no visibility. Remember our disparate community, right? I'm going into eClinicalWorks or Athena Health or whatever my EMR is, and I'm probably looking at just my siloed view of that provider directory. I may have a PDF of that directory, or I might could navigate to a website. But here we've got it updated weekly, and we can really see those providers and who we want to refer to that's in our network. And so with this dashboard now, we're also seeing this information real time. So as referrals are happening, we're seeing trends develop around who's referring and who's receiving the referrals. If we go out of network, why? And so this is really, we can give this information to, like a practice performance specialist, an ACO kind of manager, to keep those patients in network, explain why it's important, all the reasons we've talked about, like care coordination and cost. We can also address any workflow issues. And then with the information that Ryan presented with us with quality and cost, we can also implement the provider directory so that we have a lot more facets of the search, including in and out of network, quality, cost, proximity to patient, things of that nature that can really help to drive that leakage down even more. So let me pass that over to David.
David, I think you are on mute.
David, can you hear us? You're on mute.
How about now?
Much better.
Perfect.
I apologize. Next, we'll work on fixing the mute button with Proficient Health. But we had an outside consulting firm, a Big Four, come in and review our leakage and referral situation. We found a $200 million hole there that had to be plugged. And most of this was around loss to follow-up and going out of network because of the time associated with it, and not having a standard operating procedure to direct referral coordinators to the proper in-network specialists. So we used PH Exchange, and the big problem here is half of our network is completely independent from Cone. We had 58 disparate EHRs. That's just brands, not the instances. And so Proficient Health, under the guidance of Wayne, set forth to integrate those and have one single standard work process for every single practice and every single specialist. That really got us into the right groove to make sure that we were doing it all the same way. But more importantly, that the receiving end of that was getting all the information they needed to actually act on and make an appointment in real time or more immediate time. The result was that just in the first 6 months, $2 million was saved by reducing that leakage. And so I want to thank Proficient for that, and made me look really good in the process. Back to you, Ryan.
Thanks, David. All right, so now we've spoken about addressing network leakage with Proficient. I'm going to talk a little bit more about growing your network. Now, the Salient Healthcare platform, it's predicated on continuous process improvement, and I'm a little bit of a CPI junkie. So I wanted to show this quick diagram that shows just what we're looking to accomplish. What you want to do is continually monitor your performance. Then you want to investigate anomalies. You want to analyze to locate new or continuing areas of opportunity. And then you want to make adjustments as you go along. Once you're done, the process actually starts all over again. So you're never really done. Just keep in mind, Once you've addressed a particular area of opportunity, you're also going to find new challenges that are going to arise. So in the case of network management, you want to keep in mind that to some degree, out-of-network utilization is inevitable for most provider organizations. And to be honest, there are many valid reasons for some out-of-network utilization. Some examples might be, and this might be the most ubiquitous, just general politics. I mean, hospital-based ACOs are certainly going to face challenges that provider-owned ACOs are not, just because it might be less expensive for the hospital-based ACOs to then send their beneficiaries out of network. I personally see that happen fairly often, especially when it comes to things like labs and imaging. Your second most frequent occurrence that I see is that you might also require assistance from a particular specialty that maybe you don't have that in network. And then third, you'll run into patient preference. So some patients prefer to see providers with shorter wait times, or some patients already have prior relationships with out-of-network providers. You might even have patients that insist on seeing a particular out-of-network provider, and that's just because, I mean, maybe their friend goes there too. So basically what I'm saying is that there's a myriad of reasons that you may incur more out-of-network utilization. Addressing some of these occurrences as they pop up is going to take a little research on behalf of you and your team. Okay, so now it's time to hand the baton back off for the last time. Wayne is going to talk a little bit more about network growth.
Good segue. So yeah, let's continue on the analytics, right? So we've set up our standardized network, which I keep referring to because it's just so important. And we talked a little bit about some easy things we did about instrumenting our provider directory and getting that out there and getting that managed. So now that we can know where to go and why. But now as we're leaking out, like, where do we grow the network based on that analytics, right? So, these dashboards now are a deeper dive into our out-of-network traffic, right? So not only, like David said, can we manage that percentage of leakage, we can also see that by specialty, and then we can also look down and we can look at a heat map, right? So here we can quickly look, as a practice performance specialist, ACO management, as David said, we can start to develop trends on why we're going out of network. And with the workflow that we've put in, right, in the referral management, we can enforce things to happen. Like if we do go out of network, and of course, we're never going to disallow someone from doing that, a referral coordinator, but at least we want to capture why. So as we look at the heat map now, we can look at reasons and we can look at the specialties, and we can now formulate a plan on growing these in the right way, in the right proximity. Like Ryan said, maybe that's geography, maybe that's specialty, maybe that's patient preference. All of those things combined, we can now smartly, grow our network on these. And so, as I mentioned before, I think the combined analytics, right, between Salient, Proficient, marrying those two together just provides a wealth of information to ACO management, to make those good informed decisions on all the things we've talked about, right? Including cost, quality, and all of those out-of-network reasons. Okay, I'm gonna go back to Erica now.
All right, thank you, Wayne, and another thank you to Maria, Ryan, and David for joining us today. It looks like we have plenty of time to go through some questions, and as Garrett mentioned, you can drop those questions in your GoToWebinar control panel under the questions tab. All right, let's go through some of these real quick. Okay, we have a question. I believe this is for you, David. What made your organization begin looking for a referral management solution?
We had 200 million reasons. It was a big cost suck, and we wanted to know why, but knowing why is only so good as being able to act and change that. And so not only did we need the analysis, but we needed a way to affect behavioral change. And we always had incentives in place, but those incentives were calculated on such old data, the way claims data comes in, that by the time we got to the practice to say, hey, why are you sending patients over there when you should send them over there? That referral coordinator was already gone. There was turnover in that position, or it was so long ago that now it can't affect their incentive payment, so it wasn't really top of mind. But now our administrators, our practice performance team actually goes to individual practices with their tablet and shows the Proficient dashboard saying, hey, you're sending them here, you should be sending them here. Or as Ryan mentioned, there is sometimes good leakage, and we can see that as well in real time. And we're able to tell the providers exactly how they're being affected monetarily by this activity, which makes change happen a little quicker, as you can imagine.
Awesome, great. It looks like we have a couple more questions we can walk through. My organization is in an area where there are less choices. How do I engage with specialists to ensure they continue to improve quality of care and lower costs?
All right, I'll take that one. So you're going to start your engagement with improvements in quality of care for patients. Most organizations and specialists really want to ensure that their patients are getting the best possible care. Engage with them on creating non-binding compacts that specifically outline the expectations of excellence.
Great. I think we have another question here. My organization is engaged in several value-based contracts, including Medicare and commercial contracts. Our networks differ across each payer. How would I see my in and out network utilization?
Yep, I'll go ahead and take this one. And so what we can do at Salient, we can actually bring data in from not just any payer, but multiple payers at one time, and then adjust your networks by payer. So each payer is going to have a slightly different list of their in-network providers. We can go ahead and configure the system to then reflect those specific networks.
Awesome. We have another question here that might be for Wayne. How do you find that user adoption to a referral management solution has been from the vendor side?
That's a good one. And, I tell you, just like any healthcare change, right, workflow change, it requires some work. And we know that at Proficient. We've seen it over our 12 years. We always have a team of client success managers and account executives that really work with the implementation of the referral management system to keep the adoption driven. But it does take time. And, I would say a good 60 to 90 days. One quick anecdote, when we were actually implementing THN, there was a referral coordinator who was using eClinicalWorks, and she said, I am absolutely not going to use a referral management system. And so we, talked to her, and I told her, I said, this is going to be the best workflow tool if you just give it a chance, right? And now she came back about 6 months after using the system, and she said, I love it. And it's now our source of truth for referrals. If we need to find it, we go in, we filter our dashboard. If it's about clinical information, we actually put that back into eClinicalWorks through an interface. But really, we changed her, providing that really good workflow we talked about, really changed her mind, and the adoption was there. And that's what we try to do. We know it's going to be hard, but we work with all of the practices to make it happen.
Awesome. Another great question here. Did you actually save 200 million, or was it actually redirected?
I assume that's for me. Time will tell, but we do know that just in the first 6 months, without 100% adoption, as it takes time to roll these things out, we saved 2 million. We are working on boosting that over the past 6 months. We've now integrated a major segment of our ACO, which we believe will account for almost 100 million of that leakage now. But check back in about 6 months, and I'll let you know for sure.
Perfect. We'll definitely have an update for everyone here. We have another question. How do you educate patients about in-network plans?
Who wants that one?
Yeah.
So yeah, I think that's really a team effort, right? I think there's a lot of communication that has to come out down from the top through the ACO administration. I think the plan is responsible for educating their members, but ultimately, the PCP is the one being incentivized, right, on total cost of care. And so I do think that the referral coordinators, the practice managers there can, do a lot of the work in educating them on why that's important, both for economics, but also for care planning and care coordination.
Mhm.
The ability to transfer documents and information between your specialist and PCP is going to be much easier on you, Mr. Patient, than if you go down the street somewhere else. And in the long run, you'll have a better experience.
Great. It looks like we have a couple more minutes for a few more questions. An issue is that HHA referrals transfers are coordinated by hospitalists at the hospitals and not coordinated with the PCP. It sounds like Proficient Health could help with this. Wayne, do you want to maybe take that one?
Yeah, and if I understand the question correctly, it's I think I call that the centralized model, right? So we both support, a decentralized model like what we do in most ACOs around, a primary care with specialty referrals. But also we can do that in a centralized fashion where we've got, a team in the hospital or a team in a certain facility that might coordinate around one type of referral. So it's just a different model, but the system still supports that. We didn't talk too much about, all the different ways we interface, but we still support fax documentation and integrations with the EMRs. And so we can really leverage that too in that situation to have that information at those referral coordinators, making their job better in the centralized workflow.
Perfect.
Just wanted to chime in on that one real quick. So additionally, you do have the ability to impact the recertifications, and that's something that can be done within the practice as well.
It looks like we have a couple questions about accessing the recording and the deck. We will send those out, so no worries there if you missed the beginning of the presentation or wanted to share with a colleague. We will get that over to you. Another question here. I think we have time for maybe one or two more, maybe one more question, then I'll pass it back off to Garrett. Do you know the average or the national averages for length of stay for HHA and hospice?
I don't know them off the top of my head. However, we know that for hospice, it's about 6 months to live. So you want to make sure that your referrals are not really, really short. Otherwise, hospice isn't doing what it's intended to do. I've also seen hospice referrals as long as several years. So definitely look for those outliers and identify what's going on within your network. And HHA was the other one, Erica, correct?
Yes.
Awesome. So the length of stay is typically a 60-day episode, and then a recertification happens. So with that, again, I've seen the entire gamut of, just a couple days as a LUPA payment, and then all the way up to many, many years on home health. And that sometimes is used instead of home health, it's used as home care. So definitely another one to watch out for.
Awesome, great. I think we are coming up on time. So Garrett, I'm going to pass it over to you to close us out.
Great. Well, those are some great questions, and actually reviewing some of those. Also, another question just came in about that same thing you just mentioned, Maria, except in regards to SNFs. Do you have any information on that as well?
Yeah, so SNFs are usually paid at 21 days. So you'll see the length of stay hovering at around 21 days for the commercial or the fee-for-service Medicare patients. You'll see that MA contracts typically have a much lower length of stay, hovering somewhere in the teens. So take a look at those to see if you have any outliers with those as well.
Great, very good. Well, thank you all so much. And there is questions that are continuing to come in. And please, if you have something kind of last minute, submit it. We will get to your questions via email afterwards. So don't worry about that. And again, we want to hear from you. So please reach out in that regard. As we close out here, I wanted to encourage you all to visit the ACOexhibithall.com. And at the ACOexhibithall.com, you will see we've got booths, interactive exhibit booths for both Proficient Health and for Salient. And you can see that on the screen here. Look very similar, but you can interact with the team there. There's all kind of different materials to download. It's a really cool interactive experience. There's library, archive material, all kind of stuff. And that's also where the recording from today's session is going to be housed. We will have that in our archive library at ACOexhibithall.com. But I will be sending that out to you as well. I know we did have a question that came in that regard. So I'll be sending out an email to all the registrants, even if those who didn't make the attendance today, and they'll have not only the recording, but also a place where they can download the slides. So you should be able to have access to that recording. And then lastly, if you have any questions for any of our speakers or the Proficient or Salient or Cone Health team, please reach out. Their contact information is here on the screen for you. So, and we're going to leave this up for just a minute as we close out. So that you can jot that down and reach out to one of them. So thank you all so much for attending. It was great to have you here today. I know there's a lot going on competing for your attention, and so we really appreciate you taking the time to spend with us. And I hope this was informative and that you got a lot out of it. So have a great rest of your day, stay safe, and have a wonderful 4th of July coming up weekend. All right, thank you for coming.
Thank you.